Good evening, all. We are commencing our webinar series. I am Dr. Soumya, National Chief Program Coordinator, Organization for Food Safety Solutions and Awareness. I am very happy to tell you that this is our third national webinar on the head note food safety for children organized by OFSSA. And today's webinar on the topic foodborne diseases, causes and precaution. It is one of the most important concern for the present economy due to so many burden, health as well as cost burden to the society. So it is a relevant topic for the today, and it is jointly coordinated by coordinators from the state of Karnataka, Tamil Nadu and Kerala. I'm very happy to welcome each one of you into this webinar. I welcome all the state and national leaders of OFSSA, our resource person, Dr. Kiran, Consultant Pediatric, Welcare Hospital, Kochi. And most importantly, each and everyone joined in this webinar. The participants are the success of any program. I welcome each and every participants into this program. So, before starting our session, let's bind our mind together for a prayer. The purpose of prayer is not to influence the God, but to influence our own mind. I welcome Grandmaster Tirtha Vivek for the prayer song.
Bind us together, God, bind us together, bind us together with love. There is only one God, there is only one body. Bind us together, God, bind us together, bind us together with love. We are the children of God. We are His promise divine. Bind us together, God, bind us together, bind us together with love. We are the children of God. We are the children of God. Bind us together with love. God, bind us together with love.
Now we are moving to our webinar session on foodborne diseases, causes and precautions. The foodborne diseases are a major concern not only for the medical practitioners but also for major concern for economic policymakers. High time to take a note on this topic. And for the government, increasing cost of foodborne diseases and its healthcare cost is a very serious burden on this. So in this occasion, it is very relevant for each one of us to take a note on foodborne diseases and try to understand what are the major foodborne diseases and what are its causes and precautions have to be taken. Today we have young and vibrant personality to provide awareness on foodborne diseases. With great gratitude, I welcome Dr. Kiran Nair, Consultant Pediatric, Welcare Hospital. He has more than 12 years of experience in pediatric and 4 years of experience in pediatric critical care. He is a life member of IMA and in the Indian Academy of Pediatric. With great happiness, I welcome Dr. Kiran for the session. Over to you, Dr. Kiran.
Okay, thank you, Dr. Soumya. Am I audible?
Yes, doctor, you are audible.
Okay. So first, I would like to thank OFSSA for giving me such an opportunity. So without wasting much time, let me go on to the topic. So can we have that slide presentation?
Yes, doctor, I am sharing.
Borne diseases. So this is such an important topic. As Dr. Soumya had mentioned, it's very important regarding not only the health aspect, also the economic aspect of the family. Okay, next slide. So just a general thing. Next slide, please. So what happens is, this is a general thing. So there will be a source of contamination. The transfer of bacteria happens, which will make the food potentially hazardous. And when the hazardous food is kept for some time, there is the bacterial growth occurs, and this same food, when eaten by people like us, it causes food poisoning. So this is just a general. So next slide. What we will discuss today are on the following things. So I'll discuss regarding what is foodborne diseases, the classification, main causes, the contaminants, epidemiology and transmission, the people at risk of getting these infections, and also the prevention and control, what can be done. Next slide. So what is foodborne diseases? So any disease resulting from the consumption of any contaminated food, the pathogenic bacteria, virus or parasites that contaminate the food, as well as there are chemical or natural toxins. Any disease resulting from this is called foodborne disease. So on coming to the classification, it can be broadly classified into poisonings.
No.
Yeah. So the main causes what comes across are like cross contamination. That is when microorganisms are transferred from one surface to another. Another is time temperature abuse. When the food is exposed for high temperature for more than 4 hours. Also due to the poor personal hygiene of food handlers who act as carriers of these infections. Next. So WHO estimates that there are at least 1 in 3 suffering from foodborne diseases worldwide every year, and 1.8 million die from severe illness related either directly or indirectly to the foodborne diseases. So, among them, Campylobacter and Salmonella, these are common bacteria which cause 90% of the food poisoning, and hence WHO has made food safety as one of the top 11 priorities. Next, so the 3 types of contamination are, it can be either, next slide. It can be either physical contamination, chemical contamination, or biological contamination. So physical contamination is something like anything from the handling of food to the transport, processing, anything which causes contamination is physical contamination. Sorry, the slide is not changed.
Doctor, I'm changing the slide, but it is taking time to come in this window.
Fine, fine. Okay. So I'll continue with the presentation. So
Doctor.
Next is the chemical contamination. Chemical contamination is any chemical substance which get into the food during the processing up to the consumption of the food. So, and the biological contaminants are the microorganisms which can cause contamination of food. Next, coming to that, my biological contaminants, it can be either bacterial, viral, fungal, or parasites. So we will discuss the common organisms. These are just the common organisms which we come to, like we come across during our day-to-day practices. So like bacteria. So we'll discuss first the common bacteria. They are next will be botulism. Botulism is caused by Clostridium botulinum. It's a bacteria. And what happens is the botulinum, the bacteria produces toxin under very low oxygen conditions, and it is commonly transmitted through homemade, canned, preserved, or fermented foodstuffs. When this ingested through improperly processed food, the bacteria or the spores survive and they produce toxins in the human body when there is a favorable condition. And it is also found in low acid preserved vegetables like green beans, spinach, mushroom, salted and smoked fish, also canned tuna. And sometimes, like infants, there is when you give honey, the spore will be contaminating the honey, and it can cause infant botulism. So it is very common in village areas, like people give instead of breast milk the honey to the child, infant, less than 6 months old babies. and they will present with botulism. Botulism can cause actually paralysis. It causes a descending paralysis, like from the head to the head, eyes, then neck muscles, so swallowing difficulty, respiratory muscle, it can cause breathing difficulty, and slowly there will be complete weakness of the child. Unless you treat it with a botulinum antitoxin, it will cause severe paralysis and even death. Next slide. So what we can do is in this case that commercial canning. Next, commercial canning at very high temperature, it can at least reduce the incidence of botulism in canned foods. Also, refrigeration temperatures combined with salt content and acidic conditions can also reduce botulism incidence. Next. So next, coming to next bacteria, E. coli infection. So E. coli is also another common bacteria which when infected, like it produces Shiga toxin, and when the person consume the food within 3 to 8 days, there will be the symptoms starting. The symptoms are mainly dysentery. Dysentery is when you see diarrhea, like watery stools along with blood, that is dysentery. And in some certain severe cases, this E. coli can even cause kidney failure. So it is the common sources of E. coli are undercooked ground beef actually, then unpasteurized apple juice, undercooked fruits and vegetables, also raw milk and dairy. Next causes more infection in especially in immunocompromised older individuals, children and pregnant ladies. And this can cause severe infection and in the blood also of the patient, and can easily lead to death unless we treat it with the appropriate antibiotics. So next, coming to the next bacteria, so it's Salmonella infection. Salmonella is a common bacteria, as you all would have heard about typhoid fever. Typhoid fever is caused by Salmonella. There is Salmonella typhi. Also, there are other types of Salmonella like non-typhoidal Salmonella. So Salmonella typhi is the one causing the typhoid fever, and the non-typhoidal Salmonella are also there, which causes more diarrhea and vomiting. So it also causes foodborne. These are all foodborne diseases. Salmonella causes like when you ingest the food which is contaminated with Salmonella, the bacteria get into our small bowel, intestine, and it multiplicates inside our gut, and it gets spread to other organs like liver, spleen, gallbladder, and then after that it goes to the bloodstream of the patient, and then it produces the symptoms. Usually it may take from up to 1 to 3 weeks for the symptoms to come once we start eating the food. So typically the typhoid will have that typhoid fever, very high grade fever with severe abdomen pain, then vomiting, all those things. Salmonella, there is thing we have prevention through vaccination also. There is typhoid vaccine available, which we can give up from 2 years of age. And also there, when you are planning a travel to a area where there is high incidence of typhoid, you can get the vaccination done just before the travel. Around 2 weeks before the travel, you can get vaccinated and then go to the place. Next bacteria is Shigella. Shigella is also a common bacteria which it usually comes from the human intestine, and from the human intestine through the stools it comes out, it pollutes water, and it usually spread by flies and food handlers. So it is very important to have these food handlers check for all these infections. So now even our government has made strict rules to have health card for all the food handlers. And Shigella causes diarrhea, fever, abdomen pain, dehydration. Common sources are human contact, salad, ready to eat pastas, lettuce, etc. And another two bacteria, common bacteria which cause food poisoning are staphylococcal food poisoning, which is caused usually due to the staphylococcal toxin. So especially immediately after having the food, within 2 hours, the person starts showing the symptoms. 2 hours of consumption of food, patient starts showing the symptoms in staphylococcal food poisoning. Also, there is another thing, that is cholera, which we all have heard about. Cholera is it was a deadlier disease earlier, and but after the invention of like antibiotics and all, the incidence of cholera has drastically come down. And cholera used to cause stools, that is very much watery, like rice water, like diarrhea in children and also in adult population. And it cause severe symptoms like muscle cramps and low blood pressure, vomiting, everything. So next, coming to the common viral illnesses. Viral illnesses which we will discuss are only just three of them, which are very common. So one is hepatitis A. Hepatitis A, what you will all be very familiar, because there are a lot of natural treatment running in the world for hepatitis A. Hepatitis A is a virus which causes jaundice. It mainly affects the liver. So it is spread through direct contact or infected food or sewage contamination. And the symptoms, usually after the person contact the virus, the symptoms may take up to 1 to 2 months to start manifesting in the individual. Hepatitis A affects liver, it causes jaundice, and it can even lead to liver failure, which may lead to even people, there are cases reported, people having to have liver transplantation after the infection. Next is rotavirus diarrhea. Rotavirus diarrhea is a common diarrhea which happens in infants, less than 6 months children. It's a common cause, most common cause of diarrhea. And so exclusively breastfed children up to 6 months, if you are breastfeeding exclusively, there is very less chance of getting rotavirus infection. Also, there are a rotaviral vaccination which is there now in the national immunization schedule. The government is providing rotaviral vaccination. Also, improved sanitation and hygiene will reduce the incidence of rotavirus diarrhea. Another common viral diarrhea is norovirus diarrhea. Next slide. Norovirus diarrhea, it was earlier described as winter vomiting disease. So it causes diarrhea, vomiting, and it is also caused by infection from direct contact or through foodborne contacts. Next, coming to fungal infections. Fungal infection, the common one are mold, which you will be seeing in the, when you keep the bread and all open for some time, you will see mold growing. It causes an unpleasant smell also and discoloration. It can produce toxin. For example, aflatoxin is caused by aspergillus as a fungus, and it can cause liver disease. Yeast, which you use for preservation of food, also can cause contamination. So when there is evidence of bubble or alcoholic smell and taste, then it suggests that there is damage by the yeast. Food such as jellies, honey, syrup, fruit juices are commonly loved by yeast. So next, coming to the diseases caused by parasites. The common parasites which cause diseases are cyclosporidiasis and giardiasis. Both of them are like ingested through the sporulated oocyst is ingested through contaminated food and water. It reaches the intestine, and after that the oocyst excision happens and it causes contamination. So giardiasis is also a common disease. Giardiasis, it is a protozoa like amoeba. Amoeba you have heard. Same as giardia is also similar protozoa. And it is usually affecting people with some immunodeficiency like IgA deficiency. And it can be easily found out through stool test. And the treatment is metronidazole, which is a commonly available antibiotic. And other diseases caused by microorganisms are toxin mediated diseases, like these bacteria, fungus, everything can produce toxins. Next slide. So coming to other contamination source other than biological contaminants are physical contamination. Next, physical contaminants are like any foreign matter such as hair, dead insects, jewelry, the glass pieces and metal pieces. All this can, when contaminate the food and when eaten by people, it can injure the patient, or also it can introduce bacteria. Next. Then next slide. Chemical contaminants, which these are any chemicals which accidentally get into the food from different sources. It harm the consumer, or it can cause irritation and discomfort to the patient. Like commonly thing is kitchen chemicals such detergents, disinfectants, sanitizers, pesticides, all this, and even incorrect use of containers causing chemical reaction can also cause chemical contamination. And next, so these are the at-risk people, that is children, less than 1 year of age children, elderly people, elderly means more than 60 years of people, then pregnant ladies, and also immunocompromised. Immunocompromised is those suffering from severe infection like tuberculosis, HIV, and then those on cancer, chemotherapy. All these are immunocompromised patients who get this infection very easily. Next. So coming to the prevention part, already I have discussed some parts like some vaccination. Vaccination has been used as a prevention method for many of the diseases like typhoid and rotavirus, then cholera and hepatitis A. These are usually vaccine preventable diseases. Then other major prevention which we all can do at our home, which is even approved by the FDA, include these basic 4 steps, which is next slide: cleaning, separation, cooking, and chilling. So cleaning is basically cleaning all the surfaces, like cleaning the surfaces where you cut the vegetables or where you wash your poultry, every chicken, meat, everything. Also the surfaces and the utensils, the dishes, everything you have to clean before using. Next is separation. When is separation is like when you from the point of purchasing the goods, like you have to separate before buying the goods. Like if you are buying a good from a supermarket, you are getting chicken, meat, you are getting vegetables, you are getting raw other cooked foods, and even sometimes the rice, everything. You will have to buy it separately. You have to buy it in a separate cover so that you don't mix everything. Even after coming to home, you have to separate it. Even the cutting board you are using, it is always better you use different cutting board for the vegetable and different for the meat, so that the contaminants from the meat surfaces or the vegetable surfaces don't get cross contaminated. And even if you are using the same cutting board, after using the vegetables, you have to wash it through with hot water before using it for the poultry. And next is cooking. Next slide. Next slide. So before like washing, so what cleaning means, there are usually that cleaning steps are there. When you, it's hand washing is the most important thing which you have to do before touching the plates, before touching the dishes, and after washing the vegetables, after touching the meat, and even before serving. So minimum of 20 seconds you have to spend while washing your hands. And there are usually 5-6 steps of hand washing. And what you have to thoroughly wash, scrub, then use the soap, then again rinse, then dry. And after that, that 20 seconds of washing with normal soap and water is very essential before doing anything. Like even this hand washing thing is followed all over the world, even for preventing infection from one patient to another also. Next slide. So after that, next slide. So then this is the separation thing. We have in the refrigerator or there, we have to keep all the foods differently in different layers, and so that the cross contamination doesn't happen. Next slide. So regarding cooking, next slide. For cooking, there are ambient temperatures which are required for cooking different things. So there will be different temperature. So like for beef, pork, chicken, and all, the temperature should be very high. And then coming to the pre-cooked or already pre-cooked foods, the temperature can be less, and eggs also it can be less. These are the just a guideline. You can easily get it from the FDA sites. The temperature range for each items. Next, next slide.
1 second, doctor, it just stuck. I'll
Okay,
share
okay,
it now.
okay, okay. Then there is like a 2 hour rule is there regarding the food cooking and all. That is 2 hour rule means when you buy a food out from outside, you bring it to your home. So if it is within less than 2 hours, you can consume it. You can, it is okay to use. Or if you are keeping it in the open for more than 2 hours, it is always better to refrigerate the food item, and after 4 hours it is always it is better to throw the food outside. Don't use any food which is kept in the open for more than 4 hours. That's a very important point. And so this is our last slide. So I think I have covered some of the things which will be useful for you, but this won't be enough. All theory is not enough unless you practice the things. So it's better we people all read something from the FDA site how regarding all these things. Okay, thank you for the opportunity also.
Thank you so much, doctor, for helping us to clearly understand what is foodborne diseases, what are the types of foodborne diseases, and what are the causes, and what has to be done with that as a precaution. Thank you, doctor. Thank you so much for your valuable time and your effort for making us to understand this. I
Thank you.
invite Dr. Kavita for a concluding remark. All the participants kindly note, after the concluding remark, there will be an interaction session. Meanwhile, if you have any queries regarding this foodborne diseases, you can ask the doctor during the interaction session. So